like
That'd be
introduction
great.
again. We're talking about how to get organized. What does that mean? What does it mean to organize with your peers? How do you make collective action? And all of this is rooted in my experiences with the Nonviolent Medicaid Army, which does a lot of learning about social movements through the University of the Poor. And so, Natalia, would you just read the quote by MLK at the bottom of the screen?
Totally. History has taught it is not enough for people to be angry. The supreme task is to organize and unite people so that their anger becomes a transforming force.
Awesome. Thanks. Just some words of wisdom to ground ourselves. This is just a slide about me because I've like done some brief introductions with you all before, but as I mentioned, went to med school at University of Maryland. I'm originally from Maryland, like right outside of Baltimore. And but that first picture, top left, not from Maryland. And during med school, I got to travel to Peru, did some uh, work with a public primary care clinic there, as well as an ER there, donated two of the butterfly ultrasound probes that you can use with tablets, and did some ultrasound training. That's really where like my heart in medicine lies, like kind of where I came from, and doing some global health system infrastructure. And it wasn't until more recently that I started looking into the advocacy and organizing around single payer. I didn't have very many pictures from residency itself, but this is about like a couple weeks into residency. The next picture to the right, we all tried on a high flow nasal cannula to see what patients experience when we say, you need to put this on right now. Your SATs are terribly low, and it's really uncomfortable. And then the next picture is me on my last day of uh, EM residency when I ended early and decided to switch my focus to a preventative and population health kind of career focus. And then that fast forward to the bottom left picture, that's the van that I moved into, came out first. I was in Leadville with my dog, Alba, at Alpine Lake. And then the next picture is what my office looks like now. And that was this like nice iced coffee that one of the grandkids of the farm made me on my little stump with work gloves and goji tree transplants. And that's me and my partner, Sarah Jane. We just got engaged 2 weeks ago. Um, so that's just a little bit about how I got here. Well, didn't talk about my introduction to PNHP, but um, so the goals for this session today are kind of like I already alluded to present an alternative learning model based off of the University of the Poor, where everyone is contributing into a collective kind of learning environment. We all have things to share and reflections and questions and experiences. Another goal is to identify um, both opportunities and barriers to organizing healthcare workers effectively. And I think effective is the like key point there. Where we've all seen the many organizations, professional societies, even unions that are out there. And how do we make all of this energy into an effective stream of change? And then some more practical and like goals for today would be to start talking about base building and bring base building to SNAP chapters and PNHP chapters in order to grow the member base. And today we will be practicing this specific type of conversation called an organizing conversation amongst ourselves, and then with a goal to bring that back to our med schools and institutions. Um, the way we'll meet these goals today, this is our agenda. We'll start with some community agreements and grounding that's based in the Nonviolent Medicaid Army's kind of way of grounding talks like this. We're going to talk about and share our own prior experiences with organizing, and we're going to discuss some of the themes from the readings and the documentary that maybe you all got to watch and read. We'll talk about theories of change and mechanisms of change that social movements have used in the past. And then we'll get into the nitty-gritty of what is base building, why is it important, who is the base, what are we building? And we'll do an example organizing conversation, and we'll break out into pairs and actually practice them with each other. Okay, so I wasn't here at the beginning of the internship, so have you all gone over collective community agreements? Can anyone share a few if you have any? Like norms of how to keep the space like safe and respectful for everyone.
We did not have an official plan, but we did
Okay,
that.
okay, no worries. So I'm gonna share the ones from the NVMA. And let me just pull up my speaker notes too. So these are ones, yeah, shared with every kind of meeting and chapter of the NVMA. One mic, self-explanatory, one person should speak at a time. It's pretty easy to do on Zoom. Step up, step back. If you feel like you are speaking a lot and contributing a lot, take a step back to provide space for other people to contribute. And if you find yourself not talking, try to step up and contribute some comments, ideas, or questions. That leads us to we are all responsible for the success of the space. In contrast to a lot of top-down education structures, which is often experienced as a product to be consumed. Here today, we believe that everyone has the ability to both learn and teach. So we'll expect everyone to take an active role in the success of the gathering. And speaking to that, no one knows everything, and together we know a lot. So this asks us to be humble and to also share what we know, and share our questions so that everyone can learn from us. That brings us to assume positive intent and take care of impact. Not everyone comes in with the same background of experiences and knowledge, so assume that people have good intent, and also we should be accountable for the impact of our actions and words. Jargon giraffe, I like that one. This is the giraffe, and if you don't understand a word or phrase, you're likely not the only one. And everyone will learn from the practice of breaking down concepts and going through and really defining what this jargon is. So you can always either hold up the jargon graph or just say, hey, what do you mean by that? And then all of that kind of feeds together to the platinum rule, which is the step beyond the golden rule. Platinum rule being treat others the way they want to be treated, not just the way you want to be treated. And so these are the community agreements I've borrowed from the NVMA. And now this is another thing borrowed from practice borrowed from the NVMA to ground us in um, the struggle and the movement. This is can be a very educational, it's an educational session. We're learning political theory, but this is also grounded in people's real everyday struggle, healthcare workers' real everyday struggle, you as med students, every day working really hard. And so this is called Mystica, which is a concept borrowed from the landless workers movement in Brazil. And it's a chance to share and ground ourselves in the cultural and ideological aspects of the movement and share an emotion. So this is just a video we'll watch about a minute of from from hospital closures in Pennsylvania, which one of the readings was about. Can you hear them? No. Okay. It is just a song, so um that's weird. I can hear it in my headphones, so I apologize for that. We'll just watch it quietly.
I think if you unshare when you're sharing the screen, you can check the like share the volume on the side.
Oh, awesome. Thank you. Share sound. Found it. Share. Okay, is that back?
Yeah, it's back.
There are mean things happening in this land.
Do you hear it now?
There are mean things happening in this land. Goes a healthcare billionaire, death and suffering everywhere. There are mean things happening in this land. There are mean things happening in this land. There are mean things happening in this land. There goes a Wall Street bottom line, our health and bodies in decline. There are mean things happening in this land.
Okay. So, some really potent shots of people in Pennsylvania speaking out against hospital closures, being affected by hospital closures. And there's some really good work being done out there on these on the front lines by the working class people, by the people most affected. Um, let's see. So now I'd love to hear from you all. What experiences have you had with organizing, if any? If no, that's like totally fine too. My experience, which I've already alluded to, started in Vermont when I moved there for residency. Um, I I was at a pride parade and there was a table that the worker center put up, and they just asked me, someone asked me about my healthcare story, what's been my experience with healthcare. And actually there was a place to write it down, and I preferred doing that than like speaking to someone. And so I just like wrote some things. There were some boxes to check, like what kind of insurance do you have? And I was in a place where I really wanted to um be involved in something that wasn't clinical medicine. I wanted to be involved in something that felt bigger. And so I was really ready. And I've been doing a ton of political education with them. I've been doing canvassing, knocking on door to door. We've regularly attended or gone to a local shelter, like thrift store and food kitchen has meals, and we go there and sign people up for help people start the process of signing up for Medicaid if they're not already on it. And it's become like a political home for me. And now that I'm not in Vermont anymore, I can still stay connected with that movement. And so does anyone else, I think we can go around. Does anyone want to start us off talking about any experiences they've had with organizing? And if you don't have any experiences, that's totally fine. Lauren, have you done any community organizing?
No, I haven't. So, I don't know if I can speak much about it.
Okay, yeah, that's totally fine. Are you interested, or have you seen anyone else do any organizing?
Um, in my class, I don't know if this counts, but like people in our student government had passed around like a petition for us to sign regarding the big bill that was passed recently. So before it was passed, they were kind of petitioning for it to not be passed. But things like that I thought was it made me realize like my voice matters, even though I'm like just a first year medical student. So it was a really impactful thing that they did.
Yeah, totally. I remember I was in med school during the pandemic, and the like massive Black Lives Matter movement, like kind of at the beginning of the pandemic. And I remember like it felt really powerful to be able to like wear a white coat, whatever that means. Like I don't wear a white coat otherwise, but to speak in a public space and to bring that attention, I think that like someone in power or somewhat cares and wants to, yeah, I think I agree with you. I'm glad you had that experience. Does anyone else want to share?
I've just had experiences through mostly through school with our SNAP chapter, but pretty recently I became involved with the SNAP chapter, so we've only done a couple of things like educational or trying to get people from school to attend like different protests and etc., things like that. Yeah, and then the rest is kind of just smaller things in the past before medical school.
I think I missed the just last bit, what you said after trying to get people to attend protests.
Oh yeah. That like educational stuff, trying to get people to kind of use their voice, writing, and then other things have been like very much unrelated, but just kind of smaller personal activities in the past before med.
How was it getting people to want to be involved in the SNAP chapter?
Um, I think it's hard when when at least the way our leadership turnover works, it's like all the M1s take over leadership roles in February of their first year, and then at that point, no one in your own class is that interested in joining new organizations, so that can be pretty tricky. I think when there are new M1s, it might be a little bit easier to like catch some interest.
Yeah, timing totally helps. Okay, I think we'll go back to the presentation. If anyone can stop me if you want to say something. That work? Okay. So this is another quote by MLK. Zachary, would you be able to read it?
Our responsibility is to lead people into higher levels of fulfillment and into effective strategy that will make change possible. For if we say that power is the ability to affect change or the ability to achieve purpose, then it is not powerful to engage in an act that does not do that. No matter how much you sloganize and no matter how much you engage in action, in order for a movement to be effective, it must have the power to pull masses together, and it must have the power to make a dent on that kind of majority that has somehow allowed its conscious to go to sleep.
Yeah, I think I picked this quote because it really highlights how important getting many people together. He talks about pulling masses together, but if your movement's not doing that, there's not much change to be had, or maybe it's small reformative change affecting limited numbers of people or limited parts of life, but it's not that kind of revolutionary change. And we'll talk about that a little bit later. Did anyone get a chance to read this article? Does anyone can someone volunteer to either summarize like a takeaway or like a feeling they had after reading it?
I thought it was interesting that the author spoke about feeling like there weren't many people like people who'd worked at Hahnemann or residents, specifically residents who were speaking out as Hahnemann was closing because they were worried about their futures, but because the author, they weren't a resident, but they were a medical student, but they felt like because they're involved with this larger advocacy organization, they were able to speak through that organization.
Yeah, totally. Feeling like you're maybe silenced at your place of work or because of your profession, but through another avenue, it's like okay to be outraged. Yeah. Um, And, another discussion question I had was, I know you're all pretty early on in your training. Has anyone personally felt exploited by the healthcare system? At work, either in a clinical rotation, in the ways that deadlines are being made, in your medical school, or have you had any friends or family members, or just friends who have already gone through the a medical training? Have you heard anything from them?
I'm not sure if this answers to what you're getting at, but something that you just said, and something that I reflected on in the article was this idea of um, like empty wellness rhetoric, and this idea that burnout is it's your responsibility for self-care, and it doesn't really address the systemic issues that are causing the burnout, like documentation or just overall exploitation of greedy companies in healthcare. And in terms of how that applies to my medical education, we get, as students, at least at my school, we get a lot of, well, if you can't take it now, it's only going to get worse later. So you might as well get used to the burnout now.
Oof.
Which I just can't stand hearing. I really can't. There's got to be a better way. But yeah.
Yeah. Yeah. Wow. Um, that really hits home. And probably most residency programs are really full of the, what like I've learned to call the martyr complex. You're doing this because you love the work, you love the patients, you're doing everything for the patient, so you should work harder and you should um stay later, and it's just like becomes an expectation. You're expected to burn out. Yeah, totally. No, no. Any other reflections or thoughts on the reading? What do you think? Is it important for doctors to like think of themselves as the working class? Um, how did that land for you all? And it's okay if you don't think that that's like the right way to go, you know?
I think it makes sense in the context of, like, we've kind of had some education about the history with like the AMA and how physicians have kind of come up from like originally not like, yeah, being, well, just like not having a serious profession and not being taken very seriously. And then they got really protective about kind of developing their like physician monopoly and developed the AMA to do that. And then now things have changed in such a way that that's no longer the case, especially with like hospitals and I'm sure like just all the kind of like outside business that surrounds healthcare. Um, I think more and more we are a working class in the system. So I think that's at least a realistic way of viewing it.
Yeah. Yeah, thanks for that background that of the like history of prior to the AMA. Um, I've done some reading on that, but not very recently. Um, yeah, I think like a lot has changed in the past 20 years in terms of what the profession of being in medicine is and what the like is there autonomy anymore. And that's like completely changed the way that we are interacting in our workplace. Yeah. Um, and can just another point from the reading. Um, what does it mean to you all to like hear that healthcare can be a strategic front to unite the working class? Does that land or does that resonate at all? Um, yeah.
Um, I'll say something. Well, I'll just say yes. It does. I think healthcare is really important to a lot of people. I think I don't know. People just say this like colloquially. I forget how you say the word, but like they'll say like health is the most important asset you have, more than like wealth or whatever, and like you should prioritize your wealth. And maybe that's a more like wealthy, like maybe that's a privileged thing to say for some people, but I think people recognize how important it is to maintain your health, and when they're not able to do that, it might be something they're more willing to organize around.
Yeah, absolutely. Absolutely. That's been my experience too. It's something that crosses party lines, which is one of the main divisions that we are like told is a division today. And yeah, it affects everyone. It's the great democratizer, I think one of the people in the panel recently said. Um, okay. And then so we just have a excerpt to read from the end of that reading. And I just wanted to read it together. Can I get 3 volunteers, one to do each paragraph? You can start whenever. Yeah, Sernindi, you can start us.
Without clarity about how the system really works, we're vulnerable to divide and conquer tactics that keep us separated and powerless. It is a common assumption that we'll be most able to affect change as individuals by taking on privileged positions, such as those in academic medicine, which can only be reached by playing by certain rules over many years. But even the most professional, effective, studied career advocates have limitations on their influence.
We can keep reading.
Continue.
If someone else wants to jump in.
We will not win universal guaranteed rights to healthcare by simply persuading insurance companies with graphs, charts, or studies. There is no systematic review or NEJM op-ed that will convince hospital system executives that healthcare workers deserve humane working conditions if it means reducing profitability and breaching their legal obligation to shareholders.
And can someone else finish us off with the last paragraph? I can go ahead and do it. Oh, go for it, Lauren. Sorry.
Okay. Only mass movements of working people fighting for our shared interests as a class can do that. Health workers belong in these movements. When we remain isolated, we tend to blame ourselves for the failures and dysfunctions of the healthcare system or take out our frustrations on our colleagues and patients. By taking action together, we break the isolation and combat that despair. With the commitment to uniting all health workers, we can build a force strong enough to fight the interests of the owning class and change our industry for the better.
Awesome, thanks. Does anything from this excerpt in particular stand out to anyone that you want to talk about? I think a big thing for me here is the like feeling of isolation, like feeling that, oh, well, I'm not like good enough at my job and that's why I'm like slower and that's why they expect me to, I should be seeing more patients and doing things faster. And it can feel really isolating, and you know, we're trained to want to excel, be excellent, and we need to do that for our patients. So I think just like speaking that out loud, that everyone's going through this, is really huge. Oh, sorry. Zachary, you can go, and then Anana.
I forget someone mentioned this, but when it mentions like all healthcare workers, I always think about like how medicine's organized, like as an institution with like a hierarchy, and even and how I get that its purpose is maybe for like clinical decision making, but it seems to have some social effect of a hierarchy as well, even from like attending physicians to medical students. And it prevents any sort of like solidarity being built because as a medical student, you're not necessarily supposed to talk to an attending, or maybe even an intern might feel like they're better than a nurse, so they don't really want to talk to the nurse because they're fraternizing outside of, their hierarchy. So it's always interesting to me, like maybe how we could dissolve the social aspect of the hierarchy of medicine and make it purely for clinical decision making, just so we can maybe increase the solidarity among healthcare workers and make us all realize we're here to help patients, not feel superior to each other.
Yeah, yeah, I love that. Really good stuff. Anana?
Yeah, thanks, Zachary. I didn't think of that, but I really like the way that you put it. What stuck out to me was really in the first paragraph where they mention it's best to enact the most change or be in the best position to enact change that you want to see. You got to keep your head down while you're climbing the ranks. And I've heard that so much throughout my entire career, and it's something that I don't believe in, but it's so I think ingrained in our society because if you like we're I don't want to say taught to not speak against certain things, but there are repercussions. You'll be seen as unprofessional, then you won't be able to get the residency program interview for the program you want to get into, and it all kind of bottles up. So I do like how this kind of pushes against that and is like, no, you do have to enact change in the current position you're in and until you reach the position you want to be.
Yeah, absolutely. Feels daunting, right? But you can do it. You don't have to keep your head down, and keeping your head down will just train you to keep doing that. Cool. Well, thanks so much for everyone participating and sharing about that. Did who got a chance to watch this? No. Okay. This is a like 30, maybe like a 40-minute documentary about the takeover of Lincoln Hospital in the Bronx, in the South Bronx, by the Young Lords, which was an organization modeled off of the Black Panther Party, but they were a Puerto Rican community standing up for a Puerto Rican community, and they had some demands, which was like decent, uh, ho like hospital conditions, and it's a really interesting watch, but that's okay. I think my main takeaways from this was like we as doctors need the entire community on board because they have so many skills, and they know what they need um to make any really effective change. So I think for time, um I don't know. Let's go through this little case. A lot of medical education is our cases. So can someone who hasn't spoken in a little bit read the case?
I can read it. 45-year-old male nurse with insulin-dependent diabetes mellitus, hypertension, obesity, and 20-pack year smoking history presents for a 3-month follow-up. He works on the medical floor at the university hospital. You've heard rumors about a nurses union organizing and have seen flyers posted in the bathrooms with clear union busting tactics. After your history and physical, the patient admits that he works a specific set of hours so that he can take care of his elderly mother when the visiting nurse is not at home. He is worried about joining the nurses union because he fears he might lose the ability to keep these hours. What would you do?
All right, thanks, Mackenzie. Yeah, so any initial thoughts? What would you do with this patient right in front of you? Yeah, so to be honest, as a med student, I would probably, listen to them, say, wow, that sounds difficult. I'm sorry that's going on. And I would go and present to my attending. And that's like the system that we've built. Oops. Right. But then the prompt goes on to say, imagine your SNAP chapter has 100 active student members, your hospital's residents are unionized, your state PNHP chapter has 1,000 doctor members. What could you do? What could we imagine doing? Any thoughts there?
I'm wondering if he's worried about losing the ability to keep his hours because he's worried the union, like, because he's worried that like the hospital that he works at will have some kind of like will change his hours, or if it's because he's afraid the union that has any sort of power would not be able to advocate for the hours that he wants. Like, if you notice, because like I think if it's about the union, then he could talk to people in like the residents union and hear about their experiences with getting schedules that they want or something like that. Whereas if it's like retaliation concerns, then I think like still it's useful to talk to the SNAP chapter, PNHP chapter, like the union, just to have vocal support for the nurses union so that it's harder for the hospital to retaliate.
Yeah, love that. And I love that you start with saying, well, wait, what is your concern? What is your fear? You just like want to listen and kind of get down to that root cause. What is the fear? And then how can we as people who maybe know about union busting tactics or have experience with unionizing, how can we present this alternate that maybe that fear is not actually going to play a part. And so I love that, getting the resident union involved. Let's move on. So this is just a brief kind of overview of what types of social movements, the 4 types of social movements. You can have affect a small amount of people or everyone. You can affect, you can change a little bit of life or the system or the entire one. And so some examples, the bottom right, redemptive social movements, that's typically like a religious transforming individuals kind of thing. So we can kind of cross that off, or understand that that's kind of a different topic. Alternative social movements, that would be something like Mothers Against Drunk Driving. So a specific group of people saying, okay, we want to change this limited action to for these limited groups of people. Reformative social movements would be like the civil rights movement, where they change something like segregation, but for everyone. This affects a large amount of people and a limited amount of societal change. And then there are revolutionary social movements. That would be like the abolition of slavery, completely restructuring the political economic system. And I just wanted to put this in as a framework as we talk about more of the mechanisms of how social movements create change. And so can I have someone just read the different types of mechanisms of social movements or of change? I can go ahead and do it. So you could quit medical school now and run for office and become the decision maker, power that be. But what more often happens is you change the people in power by voting. A lot of what we talk about in the advocacy space would be influencing the decisions of those already in power, talking at public hearings, giving testimony, creating new legislation, and advocating for the passage of that legislation or opposing passage of other legislation. Then there's taking the support structures out from under those who are already in power and not allowing something that is harming or something to continue harming people, not allow the status quo to continue going on. There's actions that meet the immediate needs of the crisis, and the NBMA likes to call those projects of survival. So mutual aid, something that actually bypasses the current structure and creates something new. And then there's cultural change, changing people's minds through messaging, social media, educating, and I just want to point out that all of these like have a role. A lot of what the grassroots movements organizing the masses do are changing the support structures and kind of forcing the hand of people who are in power. And yeah, I'm not sure if the internship has talked so much about that so far. So we're going to just go and skip that case study. But I wanted to kind of switch over now and talk about how you would go about starting to organize and switch over from the theory of organizing over to like the actual practice of it. And so, like I said, I joined the Vermont Workers Center. They are a organization completely run by members. They have 3 paid staff, but otherwise completely member run. They're also politically independent and financially independent. They used to accept grants that really altered what they could do and how they were able to do it. So they decided to become financially independent. And they are part of a multi-state nonviolent Medicaid army that is a network of organizations that is uniting the 140 million plus poor people in the country. And it's actually modeled after MLK's Nonviolent Army of the Poor that was created in 1968 during the first Poor People's Campaign. And the goal is to unite people who have a similar goal and mission across identities, across races, across the rural-urban divide, and they're using healthcare as a strategic front to unite people and to create this change. And so the strategic vision of the Worker Center and which is part of the NBMA, is looking at the 3 tenets of base building, which is reaching out to new members and getting them involved in the movement. Developing leaders, getting people grounded in what are the root causes of these issues and how are we going to change this in a fundamental way, and changing the moral narrative to get to get real people's stories out into kind of the mainstream and to break that isolation that, oh, I couldn't possibly change this huge system because I'm one person, but there are lots of people out there doing it. So we're going to focus on base building today. So why is base building important? We heard from Dr. Weisbart last week, I believe, that 60% of doctors agree with a single payer system, but PNHP only has 25,000 members. It's a lot of doctors, but it's not enough to completely change, say, the AMA or completely change the legislature's mind. And so we just need more members and more people actively engaged and doing the groundwork in their states and at a federal level. I remember Dr. Weisbart saying they have this really beautiful triple aim that grows alliances that, you know, they can ally with people who want to end profiteering and those who want to start a single payer system, but they need power to do it. They need to grow their membership. And so Lauren, could I have you read the first paragraph here? What is base building?
Oh, yeah. Sorry if you could hear my dog. Base building is the ongoing systematic process of connecting with members of our base, following up with them, deepening their involvement in our work, and developing them as leaders in our struggle for healthcare as a human right. And then the steps are 1, connect, 2, debrief, and 3, follow up.
Amazing, thanks. So exactly, base building is this approach of building a strong foundation of people who are actively engaged in the cause, that you can call on to do direct action, that are there for political education. And it's kind of the start of developing leaders for the movement. The steps, like Lauren read, would be meeting a new contact, talking about that first connection, in order to solidify it in your mind and to help with the follow-up process, to help prioritize who to follow up with. And so the question then leads to, who is the base? And this is something that PNHP and SNAP need to define, but I would I would suggest that anyone negatively impacted by the profiteering healthcare system could be part of the base, and that could span professions, from doctors to techs to nurses to APPs, span specialties, and it should include patients as well. And so I think that's something that PNHP has to decide for themselves, but I think defining the base is going to be the first step to base building. And you can do this within your own SNAP chapter. You could define, who is our base? It's the medical students, or does it include the residents as well? And then one important thing to consider is how to base build strategically, because you only have a limited amount of energy and amount of people. So panning for gold is a way to base build strategically and basically shake the pan of gold and see, you're looking for someone who is enthusiastic about the cause, wants to get involved, and wants to make a commitment and put a little bit of energy in. We're not going to go through this whole chart just on the basis of time, but that's the idea of strategically base building. Does that make sense to people, or do you want to talk about it more? You can thumbs up if it makes sense. Okay. So when you're going back to school, probably in like pretty soon, in a couple weeks or something, you already have the tools, the like networks to start base building. Can anyone shout out, do you have like a study group? Do you have a clinical group that you meet once a week or a couple times a week to practice physical exams or something? Can someone tell me where you're at?
I don't have anything like that, but our school splits us up into like learning communities, like groups of 9 or 10 students, and we go over like case studies and stuff together and have like overall discussions. But not specifically physical skills, physical exam skills or clinical skill building.
Okay, yeah. I think every med school does it differently, but eventually you will get into groups that are, learning some clinical skills together, and then you'll start doing rotations, and you'll every month meet a different group of residents, and maybe every day a different attending. It always kind of is wild like that. But what you can do within these kind of already formed groups is start having what we like to call organizing conversations. These are specific conversations that are getting at listening to people and their struggles, say in their workplace or as a patient in the healthcare system. And what it's really based around is listening to their struggles, their values, and tying that to what can we do together to address this. And we already have people that other people are struggling with this also. And so where do we go from here? Like, do we think the system can change if every single person working in this hospital wanted it to and demanded it? So these are kind of the steps to an organizing conversation. You start with listening, move on to agitation, then move from I to we, and you give them an ask. So, can I have one of you read all four, like the blurb about listening and agitation and everything?
I can read it. Listening is where we're trying to learn more about the person and how they are impacted by the system. Use questions to help the person open up about their experience. What about your coworkers, friends, and family? Agitation is getting people fired up about the situation we're in by asking them to think about where they stand and if they are willing to do something about it. It starts by affirming their experience as an injustice. You are helping someone get clear about the root of their problems. Moving from I to we is where we introduce that they are not alone. We are a group of people who feel the same way, and together we can do something to change it. Ask. This is our goal, where we make our ask to make a commitment to get involved. Ask for contact information to schedule a follow-up, share their story, or come to a meeting.
Okay. Thanks, Natalia. So yeah, these are very specific conversations. It's not just, a typical talking about a specific bill that's coming up or a candidate, or it's really getting a lot more personal and detailed and understanding the person's values and if they're ready to be involved in something like a SNAP chapter, PNHP, or resident union. This can be applied to so many things. And so I was going to ask Betty if we could do a example organizing conversation and then break out into small group rooms to practice them. Hey, Betty.
Hi.
Great, perfect. Let's stop the share. Sorry, running away from me. So Betty, did you get a little bit of what the organizing conversation is like structurally, and are you feeling ready to be an example?
I heard some of it while I was typing my emails and all, and I don't mind being a guinea pig, whatever.
Okay. Even better. Don't know what's going on. So let's say that how are we meeting each other, Betty?
How are we meeting each other?
Yeah.
Let's say that we're in the lounge at the medical college between classes or something.
Okay, so we're both medical students.
Sure.
Okay. Well, hey, I'm E. I'm I'm with the Students for a National Health Program, and also I am with the Nonviolent Medicaid Army, and I just here talking to people about being working in the healthcare system, entering the healthcare system as a medical student. Would you be okay with talking about that with me?
We can talk about it a little bit. What's SNAP?
SNAP is Students for a National Health Program, where students that we really care about the state of the healthcare system in this country, and we think that the insurance is making too much money off of patients, and they're wasting a lot of money in administrative costs that would not be like that if we had a single payer system. So we're doing advocacy work, and we're building a group of medical students and doctors and residents, as well as other nurses and people who work within the system to oppose that and to make change. So can you tell me about your experience working clinically in rotations?
Well, I don't really see the billing end of it, per se. I mean, you do have patients who say that they can't actually fill the prescription that you're asking them to fill on discharge, or they're asking if you can find out whether their insurance will cover it. And like a medical student, I can't tell, who knows?
Yeah, yeah. So you see you aren't able to do what the patient is asking for, because
Because I have no
uh
idea. I have no idea whether their insurance covers it or not.
yeah. Have you seen your residents or attending struggling in the same way?
You know, if they're struggling, it's internal and I'm just not seeing it. I don't actually hear people talking about it that much. You just like they're doing their discharge summaries and sending the people out the door.
Gotcha. Does it seem like they have just a ton of work to do and they can't even stop to address something like that you may have
Oh,
caught as a
yeah. I
med
mean, I
student?
don't know about the attendings because we don't see that much of them except at the rounds in the morning. They're not there at the discharge time when these issues are coming up, you know. But the residents are just so busy that there's no way they would be able to figure out whether it was covered. You know, I mean, we just don't have time. There's no way. And the
Yeah,
nurses are too busy. You know, the nurses are also helping with filling out the discharge summary. You have to call in a social worker. Well, that's if you can get a social worker. Obviously, it's harder on the weekend when you're trying to discharge somebody, but it's a mess.
yeah. Why do you think it's like that? Why do you think there's no time for anyone to pay attention to how people are being discharged and on if they're on the right medications?
I don't know. I'm assuming money, you know, like why are it seems like medical students have to see all the people coming in and there's just not really time to do that. Like you can't actually read as much as you'd like to about some of the different conditions. You could learn more from each case, but then there's the stuff that doesn't even feel that useful for your knowledge. Like, like, you know, just insurance, like who's covered and like next year would be different anyway. So why would you bother learning that?
Yeah, absolutely. There's so much to learn, so much to apply. It seems like it's happening all the time. I think a lot of us feel the same way that you do. There's a lot of pressure to um, see more patients, get people discharged and out the door, and not enough time to do it all. Um, we're a group that's wanting to work to change that and kind of talk about it. Do you think I could jot down your phone number and schedule a follow-up conversation about this?
Like, what's the follow-up conversation gonna look like? Like, is that is it a waste of time? You know, if there's nothing we can
Yeah,
do, you know, it's like I have studying to do too, you know.
absolutely. If you don't want to sit and have a conversation about it, we can also we have a meeting happening in next week that you we'd be happy to have you at. Um, and I don't want to take up more of your time, but I think that being able to share your story, particularly as a med student with the rest of us, would be really helpful for others to learn from.
So when and where is the meeting?
It's next week, in a place that's very convenient for you,
Okay. At a time that's very convenient for medical
that
students,
you'll
right?
already be in.
Okay. Thank you.
Okay,
Well, thanks for caring about this and trying to do something about it. I just don't know how hopeful I am about it, but thank you for your efforts.
yeah. Um, okay, so end scene. Um, this was the thing I was most nervous about for this talk, to do a practice organizing conversation. And I like want take what my friend who's a middle school teacher says and like personally like model discomfort, model like being nervous, and model not knowing. And so I don't know if I landed Betty. I don't know. But um it's something like having a conversation like this and being like, yeah, is this a waste of time? No, but it's a slow and building process that just needs patience and relationships. Building relationships is the like takes the most amount of time and brings the most reward.
Yeah, I would absolutely
And
agree. Like the first time that you're asking me to spend a whole, like a meeting with one person, like I might be more interested in going and sitting in a room full of people and see like, what are other people thinking, you know? So it might be less intimidating. But also, if I hear people talking about it once, I might not be ready to jump on board. But when I overhear you talking to somebody else, or somebody else is saying that they're going to go, the more times I hear it, the more comfortable I might be with it. So and it's
totally.
that building that relationship too. Like if I already had a relationship with you, I'd be more likely to show because my friend asked me to come, you know?
Yeah, yeah. I love that. And like having a repertoire of asks, there's like a low commitment ask, like signing a petition, to a high commitment ask, just like coming to a meeting or going out and tabling. Um, so that's some really good feedback. Like, oh, I don't know if I want to have a one-on-one conversation, but I want to go and see what other people are doing in this space. So do you think we have time to go and break out into pairs? Practice for 5 minutes, and then each person will start a organizing conversation and come back in 5 minutes.